Well, look, can I tell you something? If you ask Americans, I mean, look, it's got a financing problem.
By the way, Anthony, I don't understand why Republicans don't say, you know what, Medicare, it came into effect because there were a lot of seniors that didn't have health care, and it provides a safety net.
And it's not perfect. It's not perfect because it has a financing problem.
There's waste, fraud, abuse, and of course it goes bankrupt.
Right, and by the way, in the
years.
president's plan, he says let's cut some of the waste and fraud, and yet I hear these conservatives say, oh no, you can't cut any waste out of Medicare.
Let me ask you a question.
Let me just answer your thing first. Look, first of all, we're not saying take over the doctors or take over the hospitals.
No, but
it's a financing mechanism. Right now we have a financing mechanism that says to insurance companies, take a piece of the action on every transaction with your doctor. I say, why? We now have to, you call an 800 number if you want to get through to your insurance company or buy stock in the company. I say, why? Medicare has a 4% overhead. They don't need to advertise. They don't need to make big profits. Their director makes $150,000. The director of my insurance company makes $4 million. Why does that make any sense? It's indefensible. And the more simple thing to do is to say something every American understands. You get Medicare when you're 65? Well, next year we're going to make it 55. So the year after that we're going to make it 45.
You think, though, but you think that this is the position that Democrats need to take, that the problem is not that they have gone too far left, if you define left by having the federal government more involved in this system, it is that they haven't gone left enough.
No, here's what. First of all, I know left right here because my plan saves a lot of money because all that overhead goes back to taxpayers, goes back to health care.
But like you said, though, Medicare is going bankrupt. If us taking care of seniors 65 and older is a system that is about to collapse, how does it not collapse when we expand the coverage?
No doubt about it. Whether it's Blue Shield, Medicare, Oxford, all of us, we have to get control of costs. I think it's an easier thing to do as a federal system because you have more control.
And how do you do that?
Well, let me tell you, how does Walmart offer $4 prescriptions? They offer $4 prescriptions because they go to the pharmaceutical company and say, listen, we have a giant buying pool here. You're going to give us a great deal.
Right.
Who's bigger than Walmart? We are, the taxpayer. Do we do that? No, because we have outsourced this to insurance companies who don't have it necessarily as much incentive to keep those costs down because, frankly, they're getting a piece of the action. I ask again, what value are insurance companies bringing to this transaction? Their doctors, they hold back on payments to doctors months at a time. They make us all wrestle with 800 numbers. You never hear the phrase pre-existing condition with Medicare, do you? Or at the VA, do you?
I just think there's a fundamental ideological difference, or a difference in worldview, the question of whether you think the federal government can run something more effectively and more efficiently, or private industry.
Well, let me ask you something. Just take that example. What about Medicare? Now, you can argue that the costs are going up too much, but that's true in both places, private and public. The question on Medicare, is it run efficiently? Do patients who are out there in droves fighting to don't change Medicare at all, is it an efficiently run program? According to a RAND report, it's 4% overhead.
Okay.
This company doesn't have a 4% overhead.
The problem, though, with Medicare is regarding its efficiencies is, of course, every 10 years or so, it gets in trouble. 1995-96, we had the big Mediscare debate where actually Democrats were trying to scare seniors back then. Now it's Republicans trying to scare seniors. But we were told by the Medicare trustees that Medicare was about to go bankrupt. It happened again 5, 6, 7 years ago. Now we hear in 8 years, maybe by 2019, Medicare goes bankrupt again. Now, again, a lot of that is driven by cost, but and I must say,
and demographics.
And demographics, and demographics is destiny, and our destiny is not really positive. But again, the question is, for a system that's already collapsing, to expand that from 65 over to 55 over to 45 over, before we can do that, you're going to have to tell me, or whoever supports this plan, how do we curb the cost over the next
Let me give you an example.
Can we do that right after news? We've got to do news top of the hour. Then I'm going to go back to you.
I'm going to want my name added to the show here after a while.
Well, we can kick you off the set if you don't want to finish. It's a great discussion.
This is a great discussion. He's not calling the insurance companies evil. There's not ridiculous.
Right, they're doing what they're supposed to.
This is a good discussion. Well, let's continue it. But we do have Andrea standing. What?
Nothing. She sounds like a mother.
Well,
we don't call her mother for nothing.
It's refreshing.
It is. No, this is fascinating. And again,
and surprising.
One of the problems, I think, with the president's message is it's been a bit muddled.
I agree. Now, mine, I don't know if you might not agree with my message, but it's not muddled.
No,
it's not muddled,
it's not muddled, baby. Insurance
words.
companies, here's your pink slip.
I think it's a good question about the value that they bring to the table. All right, quick look at news. Time for a look at today's top stories. Hospital officials tell NBC News that 7 civilians are dead following a bomb blast outside Kabul. The United Nations says 2 of its Afghan staff members are among the dead. This morning's attack is the latest in a wave of violence ahead of the country's presidential election on Thursday. In other news this morning, federal prosecutors say a former government informant is behind the largest case of cybercrime ever prosecuted in U.S. history. Albert Gonzalez, along with 2 Russian accomplices, allegedly hacked into retail databases, making off with 130 million credit and debit card numbers over a 2-year period. And weather experts say Hurricane Bill is expected to gain strength over the next few days. Although it's still far off in the Atlantic, Bill could track close to Bermuda by the end of the week. It's still too soon to tell if the storm might threaten the U.S. With us now, NBC News Chief Foreign Affairs Correspondent Andrea Mitchell. She's also host of MSNBC's Andrea Mitchell Reports. Andrea, thanks for joining us.
Great to see you, Andrea.
We'll talk about Afghanistan
in one second. I want to finish with Anthony, though,
Stick
here.
with Anthony. Anthony needs you.
So the question is, Anthony, costs. How do we, because the thing I hate about the death panel discussion is, and the demagoguing on that, just like the meta scare of 95 and 96, when Congress has to go back and say, okay, these costs are exploding, we're going to have to make tough choices, people are immediately going to jump back to the death panel discussion, and that gets in the way of us dealing with the demographic meltdown that we're facing. So you've got a system, Medicare, going bankrupt by 2019 at the latest. You want to expand it from 65 to 55 and over. Where do we cut costs?
Well,
that's
look,
the question.
It's absolutely the right question. And insurance companies right now have a higher health care inflation than Medicare does. If we want to make decisions, let's assume for a moment we don't want to spend $700 a night for someone to be in a hospital bed. We want to spend $30 a day to have them visited by a home care attendant instead. And we want to make that change, which, by the way, I think we should. We should incentivize people not going into hospitals, not waiting till they're in and pay exorbitantly. Well, if we want to make that change for a private insurance company, what do? Well, we buy shares of stock in the company, or we call the 800 number, or we try to beg them to do it. Under Medicare, we as policymakers can make that policy and say the Healthcare Financing Administration, HHS, we're going to change the reimbursement rate, now going to reimburse you for having that home care attendant. We can do those things. Make no mistake, we can't set up a false choice here. The status quo is high health care costs both for Medicare and insurance companies. My only question is, if we're going to try to get that under control, why are we paying profits for insurance companies? Why are we paying overhead for insurance companies? Why are we paying for their TV commercials? We know Medicare works. 40% of all Americans can look in the mirror and they're going to see someone covered by a single-payer national health care plan. Why not make that 50? Why not make that 60? Why not try to get everyone covered under that? And by the way, our economy will benefit from it because no longer will employers have to offer the care.
I will say you've succeeded in doing something that no one else has done on the show in 2 years. You made me speechless, and you made me speechless because you so clearly came here and stated your position, which is, and it took me a couple minutes to figure it out, you want the federal government to take over. You want insurance companies to get not doctors, but the funding mechanism, the pay mechanism.
Who's going to take your money and give it to doctors?
Yeah.
Basically, that's what. Now, by the way, everyone, Joe, has a single-payer system. It's their insurance company, it's out of their pocket, or it's Medicare.
Right.
So the only question is, when you're passing your money through the insurance companies and they're taking a few bucks, what are they giving to you?
Yeah, Anthony, you're in town, right? You're going to be here for a couple of days?
Sure. This is where I live.
We may get you back and continue this conversation because our complaint around here has been there's been too much heat, not enough light. Even though I disagree with you, I love you coming on saying this is what I believe in. Again, I think the president's message has been muddled. Right. We're going to cut costs, but we're not really putting mechanisms in to cut costs.
Well, this has been a great chance. Rarely do I watch your show fully clothed, so it's actually a great chance for me
to. So we have found with us Next Generation's Mike Barnacle.
Oh, boy.
Highly inappropriate.
Boy, you really know how to hurt a guy. I'm going to look like that in a few years.
No, just the inappropriate language. All right, hey, thanks for being here.
My pleasure.
We appreciate
Thanks for having me.
And what is today? I'm lost. Is it Tuesday? Maybe Thursday. Let's get you back on Thursday. Continue this conversation.
We'd love to do it.
Great to see you.
Let's go to NBC's Andrea Mitchell now, and another front that we've talked about is Afghanistan. Elections 2 days away, and a suicide blast to report this morning. Andrea, the White House probably at this point is a little worried about how these elections